Hi, I'm Janie, and this is Chase, and this is our Module 3 case study for Pamela, who has multiple sclerosis. So our main goal and priority for Pamela is to mitigate her MS symptoms and improve her overall quality of life. Since she doesn't have any cardiovascular risk factors, we don't have to focus on that, and as her physicians, we can focus primarily on her MS symptoms, and her most concerning symptoms are her extreme fatigue and the drop foot in her left foot that she has noted, which could lead to some compensatory gait patterns such as vaulting, hip hiking, or circumducting. She doesn't have any serious contraindications, but she does have a 7-year history of flare-ups, and so as her physical therapist, we should make sure not to exercise her too intensely during these flare-up sessions because these are extremely difficult times mentally and physically for these patients. And Pamela is also on Avonex, which is a typical medication prescribed for MS patients, and it doesn't have any contraindications for exercise, but it could cause some light symptoms such as headaches or muscle weakness.
So we're going to run Pamela through 3 tests, the senior testing protocol, the Berg balance scale, and the dynamic gait test. These tests can all be done without using much equipment and can all be done at the same time, so they'll be done in the one initial session. The senior testing protocol provides us with feedback on physical health, functional ability, and spatial awareness. This test consists of 8 tests, such as the 2-minute step test, the sit and reach, and the up and go test. The Berg balance scale tests primarily balance and the ability to maintain balance while performing tasks that require you to shift your center of mass. There are 14 tests, such as altering your foot position, reaching down and grabbing an object. And then our third and final test is the dynamic gait index, which involves 8 tests of walking, such as looking side to side while walking and performing various tasks. This test helps us see how patients move through their gait efficiently and provides us with information on how they can perform and improve during our exercise prescription.
So the first article we looked at used aerobic training combined with blood flow restriction, and these researchers were primarily concerned with balance, thigh strength, and thigh hypertrophy. This is because poor gait patterning and not being able to efficiently move the leg through the swing phase is related to lack of thigh strength and imbalances in the knee flexors and extensors. So in other words, if the knee can't extend properly, then it can't reach through the swing phase, and that could cause the foot to get stuck on something, which could lead to a fall risk. So this study used a population very similar to Pamela. These were females with multiple sclerosis, and they were in her age range. And this study divided the participants into 4 different groups. The first group was an aerobic group, and they basically did 45 minutes on a cycle ergometer at 50 to 60% heart rate max. The second group was a blood flow restriction group, and they just put a cuff on their upper thigh for 45 minutes, and they inflated the cuff to 150 to 160 millimeters mercury. The combination group did the aerobic exercise, but they also combined it with a blood flow restriction, so they were just a combination of groups 1 and 2, and the control group finally just did their normal daily tasks. And as you can see in the table that all 3 intervention groups had significant improvements from pre to post intervention in balance, thigh strength, and thigh hypertrophy, while the control group either decreased in these aspects or remained the same. So this means that Pamela would benefit from any of these interventions, but if you look closely, you can see that the combination group had the best improvement, and so Pamela would best improve while using the combination intervention, and this would improve her gait through the swing phase, as mentioned before. The second study we looked at also uses blood flow restriction, except instead of using it with aerobic exercises, it used resistance training exercise. This was a 14-day long study that used both men and women of Pamela's age range, and they also had multiple sclerosis. These researchers were interested in fatigue and mitigating fatigue in these patients, and so they were interested in the pain throughout the exercise session as well as the rate of perceived exertion and the soreness after the session. And so there were two intervention groups. One of them was a low load group that used blood flow restriction, and they only used 20% of the 1 rep max for leg press and knee extension exercises. And the second group was a high load group, and they did not use blood flow restriction, and they exercised at 70% of their 1 rep max. And once again, they did not have the blood flow restriction. And as you can see in the table, the blood flow restriction group had more pain throughout their sets because the blood pressure cuff blocks off the metabolites from being able to flush themselves out, and this creates a decrease in pH in the muscles, which does create more pain. But there was a lower RPE for the blood flow group when compared to the high load group. So this means they didn't feel like they were working as hard throughout their sets. Also, you might notice that the blood flow restriction group noted a lower soreness level 24 hours after their exercise when compared to the high load group. So this means that these MS patients were able to complete the entire exercise with both the BFR and the non-BFR groups. And while the BFR group did have more pain throughout the exercise, they weren't as fatigued and they weren't as sore afterwards. So this means that the BFR might help in mitigating fatigue for this population, which is why Pamela would benefit from it.
This study explored the effects of how a combination of VR training and treadmill training can affect the gait of subjects with multiple sclerosis. 8 females with relapsing MS participated in VR-based treadmill training. These sessions were split up into bouts of 3, walking for 10 minutes with a 5-minute rest period in between. The treadmill was set at 80% of their gait speed, with the treadmill speed increasing 10% each week. The VR set used a forest as a background with puddles and logs to use as obstacles for the patients to step over. These logs and puddles increased in size and frequency to increase intensity. The participants were evaluated pre-intervention, post-intervention, and a follow-up after the intervention 4 weeks later. Improvements were shown in treadmill speed, gait speed, obstacle passes, the minute walk test, dual task gait speed and stride length, and the mean EDDS actually improved significantly. The next study also takes a look at VR. This study talks about how VR may affect patients with MS using a kinetic-based system. Patients were separated into a control group and an experimental group. Each patient performed a single 1-hour session 1 time per week for 10 weeks. The control group performed standard balance and gait rehab exercises, while the experimental group performed 45 minutes of the same exercises as the control group with an additional 15 minutes of virtual reality exercises. These VR exercises consisted of 3 different exercises: touch ball, take ball, and step ball. Touch ball requires the patients to try to touch the objects at different heights before they disappear. Take ball consists of moving virtual objects from an initial position to a final position in a specified amount of time. And step ball requires you to step on the ball that appears on the screen before it disappears. These exercises focus on improving balance, weight transfer, and coordination. There were improvements shown in many areas. Some of these areas consist of the BBS, Berg Balance Scale, the Tinetti test, the single leg balance for both feet, and because of these improvements, this supports the use of VR to improve balance.
For our exercise prescription for Pamela, she has agreed to visit us for 3 days a week, so we will follow up with her on a Monday, Wednesday, Friday plan. And on Monday, she will begin her warm-up with a resisted dorsiflexion exercise where she will just be resisting against a band as shown in the photo above. And this will just help mobilize her ankle, get her warmed up for the day, as well as strengthen her dorsiflexors, which will hopefully help reduce her drop foot in the long run. Pamela will start out with 3 sets of 10 reps, and as this begins to become comfortable for her or easy, then she'll progress to 4 sets of 12 reps each foot. Then after that, she will move on to a cycle ergometer with blood flow restriction, and this relates to our very first article that we talked about. And she will do much like the intervention. She will do 45 minutes at 50% heart rate max with the cuff inflated to 150 millimeters mercury at her upper thigh. And as this becomes comfortable for her, she will increase her cadence to bring her up to 60% heart rate max. And as talked about in the article, this will improve her balance, thigh strength, and thigh hypertrophy, which hopefully will improve her swing phase and her gait cycle.
So on Wednesday, we'll have Pamela perform the treadmill walk as her warm-up before she gets on the virtual reality set. This will help her raise her heart rate, and we'll have her perform this for 3 minutes at about a 5 RPE. It'll help her get used to using the treadmill while raising all of her metabolic factors, and then it'll be immediately followed up with VR-based treadmill training. She will perform 3 bouts of 10 minutes with 5-minute rests in between. The program is already designed to help her progress, so as she achieves more clearance over the obstacles, just like in the article, it will automatically increase the frequency and obstacle height. This program is designed to improve specific gait problems in MS patients.
And last but not least, on Fridays, she will do her resistance training with blood flow restriction. She will do the leg press and knee extension as mentioned in one of our articles. And she will begin with 4 sets of 15 reps with the cuff inflated to 50% arterial occlusion. And eventually her last 2 sets will include 30 reps. And once again, this just will decrease her overall fatigue and soreness, so that way she can actually complete the exercise.
This is our reference page. Thanks for listening.